Thanks for joining me today. My name's Todd Sachs. I'm a surgeon and currently the Chief Medical Officer for Access Hope. Access Hope helps connect you and your family members to a deeper expertise in cancer care. We look forward to helping you better understand the newest breakthroughs in cancer treatment. For your convenience, this webinar has been divided into 5 distinct sections so you can absorb the material at your own pace. Let's begin with a high-level view of the current state of cancer treatment. If I were to describe the current cancer treatment landscape, I would say it's complex, it's fast-paced, and fluid. In the past, we would track innovations and measure progress in terms of years. Current treatments are evolving so rapidly that now we measure progress in months. These changes aren't unique to cancer. In my career as a general surgeon, I've witnessed this shift from general surgeons performing a wide variety of surgeries to now performing specialized surgeries like laparoscopic or colorectal surgery. But cancer is even more specialized. There are hundreds of types of cancers classified by where they begin or their origins, such as the lung, kidney, and brain, as well as solid tumors versus blood-related cancers. And so it makes sense that oncologists or physicians focused on cancer are now highly specialized with a deep expertise in very specific types of cancers and their treatments. One reason we've become more specialized in selecting the right treatments is our ability to be specialized in diagnosis. We collectively call it precision medicine or personalized medicine. Precision medicine takes into account different environments as well as lifestyles. In the case of cancer, we have the ability to look at the genetic profile of a patient's tumor to make better informed decisions about the treatment plan. Access to genomics for many patients can be limited depending on where they live or where they are receiving care. Limited or delayed access to state-of-the-art diagnostics can lead to a misdiagnosis, resulting in significant consequences, including unnecessary exposure to treatments with severe and often toxic side effects. In the next chapter, we'll be talking about putting precision medicine to use. Previously, we talked about the underlying premise of precision medicine, and that is that each disease is going to be different in one person versus another. Let's take a look at some of the ways in which innovations in precision or personalized medicine impact cancer treatment. In the case of rare and complex cancers, precision medicine is so important. There are many types of cancers, such as leukemia, lung, and pancreatic cancer, that can be very challenging to treat. But by understanding the genetic profile of a specific cancer, it empowers physicians with additional tools and information. To clarify, precision medicine doesn't mean that traditional cancer treatments such as surgery, radiation, or chemotherapy are going away, as they still have a lot of value and remain central in many treatment plans for less complex cancers. These methods can still work in tandem with new therapies. These advances are improving life substantially, and targeted treatments are only getting better. In the next chapter, we'll look closer at specific targeted therapies. Among the newer and promising cancer therapies is one that harnesses the body's own disease-fighting ability: immunotherapy. Immunotherapy puts your own immune system to work in fighting cancer. When considering our own immune systems, we often think of it as fighting viruses such as the flu or bacterial infections. But the immune system is there to track and fight abnormal or unhealthy cells. As cancer cells are not normal or healthy, they work around the immune system and continue to grow if they're not detected. Here's how immunotherapy works. Immunotherapy can boost the immune system to make it work harder and produce more disease-fighting cells. And it also makes it easier for the immune system to recognize and attack cancer cells. Because the immune system doesn't harm healthy cells like chemotherapy, many patients have reported fewer side effects from immunotherapy. Immunotherapy is used to treat a range of cancers. It's been particularly promising for the treatment of lung cancer. The combination of immunotherapy and chemotherapy will soon be a standard practice for select gastric cancer patients as well. Another innovative treatment is hormone therapy. Hormone therapy is used primarily to treat breast cancer, which is one of the most common cancers in women, with prostate cancer being the second most common cancer among men. Let's take a look at how hormone therapy works. Some cancers use hormones to grow. Estrogen can stimulate breast cancer growth, while androgens stimulate prostate cancer cell growth. Hormone therapy will either block the body's ability to manufacture hormones, or it changes the way the hormones behave. Hormone therapy is a great example of how a newer treatment can complement more traditional cancer therapies. For example, hormone therapy is sometimes used to shrink a tumor before engaging in surgery or radiation, and yet it also can be used after surgery or radiation to lower the risk of the cancer returning. In the next chapter, we'll take a look at the implications of these advanced treatments and how you can access the very best in cancer care. The various forms of diagnostic and treatment advances we discussed in the previous chapters are making a tremendous impact. In the United States, the percentage of people dying from cancer has fallen 27% in the last 25 years, thanks in part to ongoing cancer research and innovation. People are living a higher quality of life with cancer because there are fewer severe side effects when utilizing targeted therapies. These advances are not only meaningful, but essential, and these innovative treatments should be available to every person with cancer. One of the main reasons that is preventing people from accessing the latest and greatest in cancer care is because of geography, because of where people live. This map shows the location of National Cancer Institute cancer care centers. These medical facilities are renowned for their cancer treatment. In many cases, these are the facilities where the advanced therapies were discovered and tested, and the guidelines were determined. But as you can see, large sections of the country do not have access to advanced care. This is where care disparities arise, when some have access to levels of care while others do not. Let's talk about Access Hope. I am so grateful to be part of this organization. It was founded to bring the best in cancer expertise to people, regardless of where they live. We don't want people to leave their local doctors. Instead, we strive to have our doctors who come from NCI designated comprehensive care centers to work with local doctors near you, to ensure our members will have access to the insights and learnings of some of the best cancer doctors in the world. Our goal is to help address quality of life concerns while ensuring cancer patients have the best outcomes. I want to thank you for joining me today. You can find out more about Access Hope by consulting your benefits website or asking your HR representative. Cancer care is evolving rapidly, and that's because there's much more information, new information, that comes from research, from innovations, new medications, and guidelines that are all propelling the cancer care treatment faster and forward. Targeted therapies can work with other cancer therapy treatments. They often work in tandem. They often are complementary. Surgical radiation treatments or chemotherapy alongside with hormone or immunotherapy. In the past, we would take a one-size-fits-all approach in the treatment of cancer. That has now evolved, and it's evolving, as I mentioned before, not in terms of years, but in terms of months, with new information, new technology, new research, new clinical trials, targeted therapy, immunotherapy, hormone therapy, all of which is making it more precise to your needs and the type of cancer you have, which in turn is helping you live a better quality life, increasing survivability.